At Children's of Alabama, we care for lots of children with fever. Many adults have questions about fever and wonder when they should worry. This video will give you information about why children get fevers, how to treat them, and when to be worried. Some information presented in this program does not apply to children less than 3 months old, or more than 3 years old, or to children with chronic medical problems. Now, before we talk about treating fevers, let's talk about the facts and also dispel the myths about them. Fever isn't an illness. It's just a very common way that we react to illness. It's a sign that your child is sick, and it's how the body fights being sick. Children may have fever related to vomiting and diarrhea, rashes, coughs and colds, or rarely, serious illnesses. Most illnesses that cause fever go away on their own. Fever is defined as a temperature 100.4 degrees or higher. We suggest you use a digital thermometer and measure your child's temperature orally or rectally. Many adults worry when a child has fever, and many believe that fever can hurt children. But fever won't hurt your child or cause brain damage, even with a high temperature. Your child's body is made to get fever, and it knows when to stop heating up. The extremely high temperatures that hurt children don't happen with a fever. Kids' temperatures only get high enough to cause damage in extreme heat, like if a child is stuck in a hot car. Many children get fevers up to 104 or 105 degrees when they are sick, and it won't hurt them. Having a higher temperature doesn't mean your child is sicker. Children can be very sick with lower fevers, or have a minor illness with a high fever. It's much more important to pay attention to how your child looks, rather than the number on the thermometer. So let's look at how you can treat fevers. When your child has a fever, your goal should be to make your child feel more comfortable, not necessarily to make the temperature go down. There are medicines like ibuprofen and acetaminophen that help lower fever, and we may tell you to give one of these medicines to your child. It's important to know the doses of these medicines. They're based on body weight and not age. We can tell you how much to give your child. We'd like to remind you never to give a child aspirin for fever because it can hurt children. Many adults worry when they give their child medicine for fever and their child's temperature goes back up later. But fever medicines only work for a short time. Once the medicine wears off, your child's temperature may go back up. Again, this is your child's normal response to illness. You may want to give medication again at that point, but first ask us about how often fever medicine can be given. Also, make sure that your child is drinking plenty of fluids, and your child may be more willing to drink after you've treated your child's fever and made them more comfortable. You may have heard of other ways to treat fever, like using rubbing alcohol or cold water to bathe or sponge a child. These are dangerous ways to treat a child's fever. You do not want to use these methods. You may also have heard that if a child has a fever, an antibiotic is needed. Well, the truth is that most illnesses that cause fever are due to viruses, which won't get better with antibiotics. And antibiotics don't treat fever. Most illnesses that cause fever go away on their own. Now that we know fever itself isn't harmful and that it's just a sign your child is sick and can be treated at home, we don't need to worry about body temperature. Let's talk about some things we do need to worry about. When your child has a fever, this is a clue for you to focus on other questions, such as, is your child refusing to drink and not making wet diapers as often as normal? Is your child fussy and hard to comfort? Is your child very sleepy and hard to wake up? Is your child having trouble breathing or have severe vomiting or diarrhea? Does your child have a stiff neck or a severe headache? If you have concerns about any of these things, then your child may need to see a doctor. Also, see a doctor if your child has a fever for more than 4 days in a row. These are the things we want to focus on when a child is sick, instead of worrying so much about the body's temperature. You know your child best, so pay attention to how your child looks. If your child has a fever with minor signs of illness, but is still active and playful, drinking well, making wet diapers, and breathing easily, you may not need to do anything, and your child will likely get better on his or her own. When your child is sick, remember to pay attention to how your child looks and trust your gut feeling. You can call your pediatrician if you want more advice on fever and signs of illness. If your child doesn't have a pediatrician, it is important to have one. Let us know, and we can give you a list of local pediatricians. Now, let's review. We've talked about why children get fevers, how to treat them, and when to be worried. Here are the most important facts. Fever is common and a normal way that your child fights illness. Fever won't hurt your child, even if it's high. You can give your child fever medicines at home to make them more comfortable, but you need to know how much to give and how often to give it. If your child has fever, focus on how your child looks instead of the thermometer. Look for signs of serious illness like not drinking, urinating less often, being very fussy or harder than usual to wake up, difficulty breathing, severe vomiting or diarrhea, stiff neck, or severe headache. If your child has these signs of illness, see a doctor. Remember, some of the information we've discussed doesn't apply to children less than 3 months old or more than 3 years old or to kids with chronic medical conditions. If you have questions about what to do when children have fever and signs of serious illness, please ask us. Be sure to get written information on fever medicines before you leave. We hope you feel more prepared now to care for your child the next time he or she has a fever.